Heart disease is the #1 killer of both men and women. In fact, the CDC cites that someone dies of heart disease every 36 seconds. That is a staggering number that, despite all the modern advances, does not seem to be budging in the right direction. In this video, I'm going to spend some time talking about heart disease, what we should be thinking about, and diving into a couple of different ideas around heart disease. First, in part one, we're going to look at it from a conventional Western standpoint. How do we diagnose heart disease? How do we treat it? What is our mechanism? Let me try that again. What is our mechanism of surveillance and screening? In the second part, we're going to flip gears and we're going to talk a little bit about the holistic approach to heart disease. What Chinese medicine, Ayurvedic medicine, what do they think about heart disease? And last but certainly not least, we're going to put together that holistic East-West treatment plan of how to prevent and even treat heart disease. All right, let's jump in. This one's near and dear to my heart. I have a hubby that had a heart attack at 41, and this topic is near and dear to my mind, something I am constantly trying to learn more about and even learn from each of you. Here's what we know for sure. There are many early warning signs of heart disease, something we should all be dialed into, some of which he missed, and we need to pay more attention to. If, for example, your blood pressure is high, you are having trouble with sleep, you're waking up throughout the night, you are getting fatigued more easily, or you're seeing a pickup in either anxiety or depression, those are some of the earliest warning signs before you even enter a doctor's office that you might be having issues with heart disease. Now let's get into actual maybe heart symptoms. Maybe you're having periodic chest tightness, or you're stuffy and congested a lot in the chest, or you have high cholesterol, especially high small particle B cholesterol or high LP(a). That's the type of cholesterol that actually sticks and can really increase your risk for heart disease. Those are some of the signs and symptoms of heart disease. General fatigue is one I would pay attention to as well. And overall, just not feeling good is something, especially if you have a family history, I would jump in to screening and understanding what your risk for heart disease might be. Here's where we start to get maybe a little hazy, to be 100% honest, because many people won't feel well, or maybe they have a number here or a number there, but they don't do the deep dive into really understanding where they are landing when it comes to their heart health. Here's what I hope and I wish all of us would do and will continue to do as we move forward. You should know your numbers. You should know where your blood pressure is. You should know where your cholesterol numbers are, and you should have a fractionated cholesterol test that tells you what type of cholesterol you might be dealing with. But in addition to that, we need to look at things like a CRP, which is a cardiac marker of inflammation. There's an hsCRP to be specific. We want to look at the other range of inflammation markers, which include a SED rate, a C4a, a TGF-beta, all of which alert us much earlier if there's chronic inflammation in the body, which we know in turn is going to be connected to a higher risk of heart disease. I would say that we even need to be paying attention to numbers like cortisol and thyroid hormone, which play an overall role in the autonomic nervous system, which is really our stress bandwidth or our stress tolerance. And those of us with less of that stress bandwidth or tolerance should be thinking about their risk for heart disease as well. When cortisol gets super high, out of control, it can trigger issues with the heart. In fact, it can narrow and constrict the vessels of the heart, increasing your risk for heart disease. So those are some of the things we should be thinking about as we're approaching heart disease, and we can pair a lot of those numbers and a lot of those lab values with actual imaging. So I like doing a coronary calcium scoring study on my patients at least every 3 years, and yearly if you know you have a family history of cardiac disease. That's looking at sort of the blood volume through the carotids and seeing how narrow it is, or if you already have a buildup of a certain level of plaque, which is going to, again, increase your risk for a stroke or a cardiac event. So that's one imaging study. But in addition to that, there's the routine EKG, which can pick up changes in your heart rhythm. There's an actual echo, which can look at heart structure. And then there's also doing an MRI of the heart. Now, depending on your risk, if you know, for example, that you come from a long line of folks that have died from a cardiac event, do a lot of these scans and tests. I say the earlier the better, and then repeat them in some sort of cadence or frequency so that you can track what your body is actually doing. So understanding heart disease and understanding all the different players is really important, but tracking and having some sort of system of tracking for you, from blood pressure, cholesterol number, sleep cycle, your stress sort of bandwidth or tolerance, even looking at other hormone markers, inflammation markers, all of that should be a part of a good heart workup. And then getting that routine EKG and some form of imaging yearly to every 3 years is really a good strategy in keeping you out of those statistics that we just mentioned. Now, when it comes to the treatment of heart disease in the Western model, it's mainly cholesterol management, blood pressure management is where a lot of the energy goes. And I'm all for that. I think if those numbers are getting out of control, then they need to be managed for sure. But in addition to that, what we're missing is the management of inflammation and the management of high cortisol, and really understanding and regulating hormone balance to help folks have a healthy night's sleep, and make sure too, during that sleep cycle, they're oxygenating well and getting oxygen to both the brain and the heart so that they are recovering and bringing that cortisol level back down. A lot of this is taking place in maybe the exam room, or you're going out to get these tests. But with the sort of rise of all the great trackers that we have nowadays, whether it's the Oura Ring or the Fitbit or any of these things, you can actually look at things like your pulse, your heart rate variability, your respiratory rate, and sometimes even your oxygen level. And if your heart rate variability, which is looking at how your heart rate changes over the course of a day or a moment, and if you're seeing that number very low, then we know your cortisol is high, and we would be concerned about the long-term effects of that high cortisol on the heart. So that's a way you can track yourself and really get a sense of what's going on with you. But now when I flip the model, and we're going now into part 2, which is really thinking about a holistic perspective on heart disease, what Chinese medicine has to say, or what Ayurvedic medicine has to say, or any of these older systems of medicine. When we flip it, they think very differently about the heart. So bear with me for just a second while I explain this. The heart was actually the energy center of the body. It's actually not just where life came from, it's where thought and emotion came from too. And every other organ system was simply subservient to the heart, meaning it served the heart. The lungs were there to help the heart. The blood vessels were there to help the heart. Your gut was there to really help the heart. It was all back to the heart. It's your shen. That's the word they used in Chinese medicine. And it wasn't just about the beating of the heart. It influenced your thought and your mind and your emotions and so much more. So they really put a lot of emphasis on understanding the role of the heart in your overall health. If you were to go to see a Chinese medicine practitioner or a holistic health practitioner, they would spend a lot of time in observation. What is the color of your skin? Are you pale? Do you have edema? Are you puffy? Those are early signs that the heart might be having to work too hard. You have deep circles under the eye. Is that an issue for you? Maybe your heart's working too hard. And then they would ask you to stick your tongue out. And as you stick your tongue out, they'd be looking for a red tipped tongue, bright red. And that was the heart meridian overexpressed, working too hard. Take a second right now, maybe stick your tongue out and see if you've got that bright red tip, because that's one of the heart signs that you can use when you're trying to put together a holistic screening of your heart health. In addition to that, many of the same symptoms they actually referred to, they talked about agitation or restlessness or congestion or chest pain as all being symptoms of heart disease. And furthermore, the heart meridian, they had mapped well before we had technology to emanate not just from the heart, but to go down the side of the arm all the way to sort of the end of this finger, exactly where people have pain when they have a heart attack. Again, Chinese medicine, almost now 3,000 to 4,000 years old, really was able to identify the heart as being a central and critical component of physical health, life health, right? But also mental and emotional health, and tied all of it together. And all of that influences what we're going to do now in part 3 with a holistic treatment plan for a healthy heart. Where do we start? We're going to start with food. We know food and diet are critical for a healthy heart. That means getting in lots of great antioxidants that really help to pump up the heart, the mitochondria that power the muscles of the heart, getting in fiber to keep everything nice and flowing and smooth, and getting in those healthy fats to really push inflammation down and support the heart and the work it needs to do. It means lowering alcohol and caffeine, which actually aggravate the heart and overstimulate cortisol. Both alcohol and caffeine in both systems of medicine should be used with caution and with moderation. A holistic treatment plan for heart health includes exercise and movement, and not just going out and doing a marathon or HIIT workout, but moving throughout your day, because movement throughout the day improved blood flow, brought blood pressure down, was a stress reliever, actually helped you with sleep, and so much more. Again, it all interconnects, all the dots continue to come together. A holistic treatment plan included adding in herbs and teas and supplements to improve blood flow to the heart. So hawthorn berry or hawthorn tea was very important and used in really improving somebody that had maybe an issue with heart health. In addition to that, using things like berberine to bring cholesterol and lipids down, or really supporting the gut or supporting cortisol using ashwagandha were used in a heart healthy strategy. So diet, movement, a few supplements targeting your main heart issue. Do you have high blood pressure? Well, there's an herb for that. There's something called muktabadi. Do you have inflammation? Well, then we need to bring that down with omega-3s and turmeric. Or are you having an issue with blood flow? Well, that might be fiber, and then adding in something like hawthorn berry. Are you having an issue with the mitochondria of the heart? It doesn't have enough power. Well, CoQ10, vitamin A, vitamin C, all of these are helpful to the heart. And last but certainly not least, before we get to medications, is thinking through, are you lowering your cortisol? Do you need acupuncture or massage or a daily yoga practice to help you bring this cortisol level down and improve your heart rate variability from hopefully not going down into the teens and 20s, but staying somewhere between 50 and 60? And then continuing to monitor your blood pressure, your pulse, and so much more. Finally, we want to be sure you're making those routine doctor visits, those EKGs, the imaging, really important in completing a holistic plan, an east-west plan for a healthy heart. All right, I hope that gives you a window on how important it is to safeguard and stay ahead when it comes to your heart health. Remember, I post new videos every week. Don't forget to like and subscribe.